for a special lecture from Dr. Malay Chakraborty. I request him to speak.
Distinguished persons in the dais, star-studded August graduates, my dear friends, ladies and gentlemen. See, I am here in this Siliguri since last 30 years. What I see today, when I started practice, there was no CT scan machine and there was nothing. The last flight was 3:45 and first flight was 11 o'clock morning. So in between, if somebody has got accident, brain stroke or paralysis, either he will die or he cannot be shifted, because by this time the homeostasis of the body goes down, patient is in shock and patient is dead. Then when I decided that I have come here because ex-Chief Minister Buddhadev Bhattacharya sent me for 2 patients whom I operated in North Bengal Medical College without anything, just exploratory craniotomy and then remove the extradural hematoma. So then I realized that why not we start here? Somebody should be frontier in everything. If you understand that who discovered America, they are the frontier. We have started from the zero. So then I realized the 3 sentences of Bertrand Russell. That is what the things which I cannot change should accept it. The things which I can change should have courage and wisdom to change it. And I must know the difference between knowledge and wisdom. What is the definition of knowledge? Accumulation of the facts. What is the definition of wisdom? Analysis of the facts. On the basis of that, I'll mention 4 people's names. Dr. who came here first as a neurologist, Dr. Chang, Dr. R.K. Agarwal, who supported me like anything, and Minister Ashok Bhattacharya did in that time. And one of my very good IPS friend, Mr. Kuldeep Singh, who was the deputy superintendent of this place. We started, and eventually I have done more than 15,000 surgery. That time now Siliguri has more than 30 CT scan, more than 25 MRI. It is a tertiary care center. I must congratulate, I must give it to Chairman Alok Roy, who have created an extraordinary corporate sector in North Bengal Medica healthcare system. Definitely that Nehotia Hospital, there we at night, any time you come to us, anytime, any problem, we are ready to help you out and doing it. We do every day 3 surgery. We get clipping aneurysm. And you see CABG is happening by Dr. Trehan. You know, Dr. Rajesh Nanda, he is stenting. So any cardiac problem, any neurosurgery problem, these are happening. Now what a real model shape is giving for the oncology, this is the gentleman who is here, Dr. Alok Roy. He has built up a oncological services and it has been given to the whole area. You see, whole North Bengal, Lower Assam, past toward the Bihar, Sikkim, Nepal, Bangladesh, all these areas. Now, all of you who are here, you see, we the doctors are basically helpless in the hands of destiny. We need the support system. What are the support systems? All technical person in the operation theater, in the ICU, in the ward, and in the radiology department, and all these departments. But who will adopt this? This will be adored, whom I congratulate, Mr. Akram, that Policy Times Chamber of Commerce member, and they have created an India Healthcare Summit 2022 here. The reason is that whole this system should come to a one pocket, and so that we can give the service. All of you who are young, I can see most of the people are very young. You have got enough opportunity and scope because they have come here like guardian, our guardian. They'll be helping all of us. We'll be also with them so that we can create a real Makkah of medical science in Siliguri, right? Now, I don't like to speak much. Everything is available now as a tertiary center. Now, this summit group who have come, let us make it a quaternary center. What are the things, few points I will highlight? like rehabilitation center, that like insurance policy. See, regarding the rehabilitation center, I say something, few lines, that if you go to each and everybody's house, 30% old people who are above 75%, both husband and wife are alone. They don't have anybody to care of them because their children are either in America or in Bangalore or somewhere else. Let us take care of them. We should promise that. This is number one. Number two, insurance. If you ask a rickshaw puller to keep 10 rupees per day, he can keep 300 rupees per month, and that will be 3,000 rupees per year. If they give this 3,000 rupees as a mediclaim, then he can get kidney transplant treatment for mediclaim. So what is happening, the councillor, word by word, MLA, MP, minister, and the insurance people and the health summit group, they can go each and every ward and to make a meeting so that they can understand that we are spending huge amount of money in mobile. We are watching TV night up to 2 o'clock. We are taking 10 cups of tea in a day. We are taking, all of us are taking more the food which we need. All of us need only 1,200 calories, but all of us are taking more than 2,000 calories. You, my 2,000 minus 12, you see, you are taking 600 calories more, 800 calories more. That money you keep and you preserve 10 rupees and put it in your pocket and make it 300 per month and 3,000 per year and give it to the mediclaim, you get all the facilities. Sir, usko rupiya nahi hai, usko ye nahi, ये सब बोलने का कोई जरूरी नहीं है. You, all of you have money, but it is to be out in the table. This is the way it can be done. So, you know all of these things. All of you can be very well off here with the help of this India Healthcare Summit group people. We congratulate them, they have come, and we'll definitely help them. Being a neurosurgeon, I'm working here since 30 years very happily. One thing is very important, a sound mind in a sound body is the first condition of success. Before I put off, I would like to say a few words. Where the mind is without fear and the head is held high, where knowledge is free, where the world has not been broken up into fragments by narrow domestic walls, where words come out from the depth of truth, where tireless striving stretches its arm towards perfection, where the clear stream of reason has not lost its way into dreary desert sand of dead habit, where the mind is led forward by thee, where into ever thought and action, oh my Father, let my country awake. Thank you very much for patient hearing. I wish you all the best and all success. Thank you.